This week's Ask Dr. Durie question is, what's new with the Black Swan Research Initiative? Well, fortunately, there are a lot of new things happening with the Black Swan Research Initiative. What I'd like to do is just to highlight a few points so that you can appreciate how this project is moving forward. The first point is that we have indeed validated the next generation flow method. And this means that we have a sensitive, standardized method using flow cytometry, which is available at most large centers, to evaluate whether or not myeloma is present in the bone marrow of patients with multiple myeloma. We have a couple of methods for doing this, one which is an 8-color method, another which is a 10-color method, and these are looking at different types of stainings for the myeloma which might be present in the bone marrow. In the United States, many of the centers use the 10-color method, whereas in Europe, for example, they frequently use the 8-color method. And so we've had to cross-standardize the 8 and the 10-color methods, and this has been accomplished. And so we are now at the point where these methods can be brought into the clinical trials and evaluated as part of the clinical trial protocol. And so we're very excited about this because we can now assess, is MRD negative being achieved with one treatment versus another? And so we have several key protocols which are now about to begin where there is an intent to push and achieve MRD negative status, which could be the most important step towards documenting and achieving cure. Now, this process will take a little bit of time, and the plan that we have set in motion is that if the treatment results in an MRD negative result, then if this is sustained for 1 or 2 years after the treatment has been stopped, this would be a sufficient documentation that excellent results will be achieved and could be a stepping stone towards achieving cure. And so this process is in motion. The testing is available, the clinical trials are starting, and so we are now optimistic within this 2 to 3 year time frame that results will produce the outcomes that we're all looking for. So there will be many new developments moving forward. We're looking to have a new blood test, for example. And so please go to the IMF website and check and see what are the newest developments as we move forward with this really exciting project.